Hi, welcome back. I'm Josh with Fisher's Health Department, and I am back this week on Tuesday, June 8th with our weekly COVID community updates. If you're unable to stay for the entire video, please take away three things. One, we are moving our community risk rating down from level 3 orange to level 2 yellow. Two, our vaccine uptake continues to do quite well, so thank you to all the residents who are going out to receive their vaccine. And three, if you haven't had the opportunity to get vaccinated and you have some concern or hesitancy about receiving the COVID vaccine, reach out to us. We would love to discuss this with you and help you make an informed decision. So, our community risk rating, it's very wonderful to be able to go from level 3 orange to level 2 yellow. It's the first time that we've reduced the community risk rating down to yellow since early to mid-October last year. This is because our primary metrics, our percent positivity and our case incidence rate, have been declining, and there's been stability in that declining trend over the last few weeks. So as of this morning, Hamilton County positivity 5.4%, Fisher's testing site positivity 2.65%, and the case incidence rate is at 4.67. So that 4.67, that is the lowest case incidence rate we've had since we've been posting our community risk rating scale online. So it's really great to see our primary metrics going in such a positive direction. So overall, primary metrics are in yellow. Community risk rating is down to level 2, indicating a moderate risk of transmission and infection. That doesn't mean there's an absence of risk, so please do continue to take appropriate mitigation strategies to keep yourself safe, including getting the COVID-19 vaccine when you have a chance, please. I didn't touch on, but I will talk quickly about our secondary and tertiary metrics. Those have been in green for quite a few weeks and they remain in green. So if you need a test, please come to us, to our testing site, and you'll be able to get one quite quickly. The results will be turned around rather expeditiously. Contact tracing is occurring quite well, and completing contact tracing under 24 hours as our team always has. And the hospital capacity is quite adequate within our area. COVID vaccine rates. All right, so we get our data each Friday from the state that has our vaccination rates for our residents through the previous Thursday, the day before we received the data. As of last Friday, 68% first dose coverage for our eligible residents and 61% full vaccination status for our eligible residents. Here behind me is a graph showing you selected age groups and their first dose coverage. At the highest is that 60 plus age group of our residents. They're at over 94%. The 40 to 59 is at almost at 75% first dose coverage. The 20 to 39 is at 57%, and the 12 to 19 is at 47%. Now, among the 12 to 19-year-old age group is that 12 to 15-year-old age group that recently became eligible. So they've had 3 weeks of eligibility at 12 to 15 years old, and we have over 35% of our 12 to 15-year-old population here in Fishers that has received their first dose. So thank you so much to family, friends, loved ones, parents, guardians, and others helping this age group receive their vaccine so quickly, providing a level of protection to them, to your family, and to our community. Thank you so much on that. If you want to pause the screen here, you can see the full vaccination rate for our eligible age groups here in Fishers. We continue to see completion of vaccine series, so individuals who are on a 2-dose schedule, Pfizer, Moderna, we continue to see individuals complete that series. And we continue to see the full vaccination rates go up week over week. So this is really good to see. Among this, these age groups are the 20 to 39-year-olds where we're starting to see a decline in uptake. So if you're in that group, or if you have loved ones, families, colleagues, and friends that are in that age group and have yet to receive their vaccine, do encourage them to receive it, and also encourage them to reach out to us with any questions they may have. So this previous Saturday, I was at the Fishers Farmers Market working our health department tent, and I had a wonderful opportunity to speak with many residents and non-residents who were at the farmers market and discuss the health department in general, but also our COVID vaccine efforts. We set up a pop-up COVID vaccine clinic each farmers market. It's right at our testing site. You can go in, walk up, you don't need an appointment. I had a wonderful opportunity to speak with a couple about their vaccine concerns with receiving the COVID-19 vaccine. They also have 2 children who are of eligible age, and the family unit, the 4 individuals, have yet to had yet to receive their vaccine as of this previous farmers market. So in a very nice and pleasant discussion for 15 to 20 minutes, I sat there and was talking about the vaccine safety, how it's developed, answering questions as best I could. And it was really wonderful to have the opportunity to speak with them and then to also see them go right across to the testing site and receive their vaccine. So I'm going to touch quickly on some facts and myths about the COVID-19 vaccine. Vaccines have been used for quite a long time to help prevent illness. The Pfizer and Moderna vaccine use a technology, messenger RNA. That is a technology that has been studied for a few decades. Pfizer and Moderna are the first using mRNA as an approach, but the technology itself has been studied for a few decades. The COVID-19 vaccine, either the three that you get, are safe for family planning. So if you are starting or considering to start a family or expanding and growing your current family, it is safe to receive the COVID-19 vaccine. Also, receiving the vaccine will not give you COVID-19. It's impossible to get COVID-19 from the vaccine, so there's no concern about getting the virus from the vaccine. The virus is not in any of the vaccines. Also, if you've had a previous COVID-19 infection, you may be considering, well, maybe I have a level of natural immunity and protection that will protect me from COVID-19. The CDC and others, and we also recommend that you still continue to get your COVID-19 vaccine, even if you've had a previous infection. There's uncertainty about how long natural immunity may last, and getting a COVID-19 vaccine, even after having COVID itself, is definitely recommended.